This is Shayna from NextGenWeb, and I'm here with Dr. Karen Rheuban. Dr. Rheuban, can you tell me a little bit about some of the projects that you're working on?
Oh, sure. Well, I'm the medical director of the telemedicine program at the University of Virginia, and we use our telemedicine network to provide services in more than 30 different specialties and subspecialties. And some of the innovative applications include remote access to telestroke services. Time is brain. Patient has 3 hours from the onset of symptoms to be administered clot-busting therapies when appropriate, and we've found, and as have others in other states, that telemedicine is a terrific tool. One can get the image of the CAT scan, one can be evaluated by the stroke neurologist, and thrombolytic or clot-busting therapies can be administered in a timely fashion using telemedicine. Some other projects we're doing is remote access to maternal fetal medicine services for underserved women who don't traditionally have access to high-risk obstetric care, which prevents premature delivery and high-risk deliveries. Improves the health of the babies. There are models in Arkansas that have demonstrated a 26% reduction in neonatal mortality using telemedicine technologies.
Wow, you're busy, I know that. Well, you gave a great presentation to legislators here today. What's one or two things you hope they take away?
I hope they take away our message that we need to align the policies, use broadband, have sustainable healthcare policies such as reimbursement for telemedicine, credentialing and privileging for telemedicine. It needs to be seamless, it needs to be integrated, and it needs to be mainstream healthcare. And that can be accomplished both on the state level as well as in partnership with the federal government for Medicare and Medicaid beneficiaries and all insured and even for the uninsured.
And I'm glad you mentioned broadband. What role do you see that playing in telemedicine?
We couldn't do telemedicine without broadband technologies, quite frankly. Video is a phenomenal tool for access to consultative services. The transfer of medical images and medical data in a timely fashion requires broadband communications without question.
Great. Well, thanks so much for talking to us today.
Thank you.